and then we'll talk about special collections and procedures. So there are certain factors that actually influence our composition of our blood, and these include your age, if you're drinking alcohol, altitude, dehydration, your diet, diurnal variation, excuse me, if you exercise a lot or don't exercise a lot, if you're male or female, if you're on any certain medications or medical treatments, if you're obese, your posture, pregnancy, smoking, and stress. So for fasting specimens, when a patient has not had anything to eat or drink except for water for 8 hours, that is usually considered fasting. Some facilities may say 12 hours, so just make sure you know what your facility's protocol is. But for terms of the test and things like that is considered 8 hours. If a fasting specimen is requested, then the phlebotomist must ask the patient if she or he has not had anything to drink or eat for the past 8 hours. And that usually means that they can't have anything other than water. So water is usually okay. Some places will also say that black coffee with nothing else in it is okay as well, but others don't. So make sure you know your policy for that as well. If the patient has had something to eat or drink during that time, sometimes you can still draw the sample. It's just going to depend on the physician and what they're actually looking for. So if they come in and it's for a fasting, blood sample, usually a lot of times we're going to go ahead and call the nurse or the doctor and ask, is it okay? And then go from there. So it's just really going to depend, again, on your procedure and your policies and what they say you can or can't do. So timed specimens, these are taken to determine changes in the level of a substance of interest over time. So a lot of times it is for medications or something of that nature. The request for the collection, for the time collection, needs to state exactly what time they would like us to be drawn. So it may say, 11 a.m. That's when we need to get there to draw it, because they're looking for a specific, level at that time based probably on a medication dose that they gave earlier, trying to see how their body is responding to that. So that's why it's very important that we make sure that we are drawing timed specimens when it says it needs to be timed. So like I mentioned earlier, a lot of times this is for medication levels. If the patient's condition is changing, they may want to monitor that as well. Patients also have normal diurnal variations of certain substances throughout the day. So some things are higher in the morning versus night. So that's kind of why those may be ordered as well. And then cardiac enzymes. So if somebody comes in to the emergency department with chest pain, they may get a cardiac enzyme or a troponin drawn, and they may need it drawn again an hour later. And that's just kind of to see, if it's going up or down and if they can confirm that it is actually a heart attack. And then it says down on the slide, these are tested at admission and then twice more at 8-hour intervals. And that really just kind of depends on, the patient and what's going on with them. And then, like as mentioned earlier, we have the diurnal variation. This refers to our normal fluctuations in our body chemistry that's related to our hormonal cycles, our sleep or wake cycles, and just other regular patterns of change within our body. So like I mentioned earlier, some things are higher in the morning than at night. So an example of that would be cortisol levels. So cortisol is usually drawn at 7 o'clock in the morning and 10 a.m. That's just because that's where your bodies, peak and go up and down. So they're trying to catch that and trying to see what your levels actually are. As mentioned down below, it says cortisol is usually twice as high in the morning than in the late afternoon. So that's where they're trying to catch that and see, where your levels are and where they should be. There are, the time for draw is usually scheduled for the diurnal peak, which is where it's going to be at its highest, or trough, which is where it's going to be at its lowest. So sometimes for medications, they may do this too. So they may give a dose of medication and they may want you up there half an hour to an hour after it's given, and that would be considered usually their peak depending on the medication. And then they might not want you back until, I don't know, 6 hours later or 12 hours later, depending on the medication for the trough, which should be the lowest. So really they're just kind of trying to test to see how it's reacting in your body and how your body is taking care of it. So there are certain blood tests that can be drawn, again, for diurnal variation. As mentioned before, cortisol is one of them. And these are some other examples of blood tests that could be done for diurnal variation, such as estradiol, progesterone, testosterone, any other hormones, because those fluctuate, serum iron, glucose, and sometimes white blood cells as well. Eosinophils can show especially pronounced in the variation for that. We can also do it for therapeutic drug monitoring. So I know I've mentioned drugs before. So here we go. Patients can differ greatly in the rate at which they metabolize or excrete medications. So that's kind of why we are testing it. We want to see how the patient is handling the medication. To maintain constant therapeutic plasma drug levels and ensure that drug does not reach the toxic level, a patient may require time specimens to measure medication levels. We don't want to give them a toxic dose. So, sometimes they'll use us in the lab to make sure that the levels are where they are expecting them to be before giving them more drugs as well. And then the rate of metabolism is often given in terms of a drug's half-life. So half-life is exactly what it sounds like. If a drug is known to stay in the body for 12 hours, its half-life is 6. So that's kind of what that means. Collection is usually timed to coincide with either the trough or the peak. Once again, the trough is the lowest and the peak is going to be the highest. The trough level is the lowest serum level and occurs immediately before the next dose of medicine is given. So that should be the lowest amount in that patient's body at that time. So that's kind of what the trough is trying to measure. And then the peak level, like I mentioned before, it's the highest serum level, and that occurs sometimes after the dose is given. Exactly when, like I mentioned, is going to depend on the drug that is given, the patient's metabolism, and the method of administration. So if it was given by an IV or by a shot in the arm, if it was just an oral medication, it's really just going to depend. So that's why it's important that we go when it says at the time on the requisition. That's also why it's important that the requisition has the actual collection time on it, because we don't know when medications are given, right? And we don't know what exactly they're looking for. So we need to make sure that we follow that process as much as possible. We also need to be careful and pay close attention to the correct timing of the draw, and accurate labeling are vital. Just like everything else, we need to make sure that we are labeling and double checking patient ID. For diabetes testing, there are 4 types of diabetes. So we have type 1 and type 2. We have gestational, and then we have diabetes that is caused by other causes. So diagnosis of diabetes or prediabetes actually relies on 4 different tests. So we have glycated hemoglobin, or it's called an A1C. We have a fasting glucose, a random glucose, and an oral glucose tolerance test. So patients with diabetes usually have a dysfunctional glucose metabolism, which causes persistent high blood glucose, also known as hyperglycemia. More than 30 million adults in the United States have diabetes, and every year 1.5 million new cases are diagnosed. So for the hemoglobin A1C test, the results of this test actually reflect an average blood glucose from the past 2 to 3 months. So the test does not require fasting and can be drawn as a random sample. For fasting glucose, the patient must have fasted. Again, that was the 8 hours that we mentioned earlier, and it should be drawn in the morning before the patient eats breakfast. For a random glucose, the sample can be drawn at any time without regard for meals. And then for the oral glucose tolerance test, this will test for both diabetes and other disorders of carbohydrate metabolism. This will measure the change in blood glucose after drinking a very sweet solution. And it has kind of fallen out of use for the diagnosis of diabetes because it's been replaced by the hemoglobin A1C or fasting glucose sample. Those are just easier tests on the patient, so that's kind of where it's going, but this is still used, especially for pregnant women. So, as mentioned, the glucose testing is still widely used for pregnant women to help diagnose gestational diabetes. So, there are different tests that can be done. So, there is a 2-hour glucose tolerance test, and that is when you are going to draw a fasting glucose, and then you're going to give them a drink, which is kind of that picture there. It's like a really sugary orange soda. There's other flavors as well, but this is kind of the most common one that you'll see. So you'll after you draw their fasting sample, they'll drink that, and then an hour after they're done drinking it, we'll get another glucose level, and then 2 hours after, we'll get another glucose level. So that's essentially what we would do, and then it would just be a little different for the 3 and the 5 hour as well. So gestational diabetes is a form of insulin-resistant diabetes that develops in about 20% of women in late pregnancy. The initial screen that we do on these patients is a 1-hour oral glucose tolerance test, and it's performed without fasting. If there is evidence of an elevated glucose in the sample, the physician will probably order a second one, and this one can be taken after overnight fasting, which would then be that 2-hour glucose. So all pregnant women, if they're under medical care, will do that 1-hour test. If they're normal, then they're done. They don't need to continue on with testing. But if it comes back abnormal, then that's when they would probably go and do a 2, a 3, or a 5-hour glucose tolerance test. Blood cultures, these are ordered to detect the presence of microorganisms found in the blood. Normally blood is sterile, so there's not going to be any in there, but if there is potentially an infection, then that's where the blood culture would come in. And if there is an infection in the blood, that is a potentially life-threatening situation. So certain organisms like bacteria, fungi, and protozoa could be found in there. Bacteremia refers specifically to the presence of bacteria in the blood, and septicemia is a life-threatening infection that is caused by rapid multiplication of pathogens in the bloodstream. So when microorganisms in the blood trigger a systemic inflammatory response, that is called sepsis. And patients with symptoms of chills and fever of unknown origin may require a blood culture. And blood cultures are ordered as a stat or timed specimen. So make sure you're, collecting those when needed as well. It's important to do that because sometimes they want it drawn, stat. They want it drawn now because they want to give the patient some medication, some antibiotics to get rid of the bacteria that's in there. And if they give the medication before we draw the blood culture, that could mess up the results and not give them the accurate organism that is actually in there. So we need to make sure that we get there in a timely manner as well. There are different types of collection containers. So these are the 3 basic types of containers for collecting blood cultures. You have that long-necked bottle, which is that bottom left tube in the picture there, which accepts a BD vacutainer needle and a tube holder. Then you have a shorter bottle, which is there in the middle, which accepts a winged infusion device, such as the BD Bactec, which uses a special adapter. And then there is also a tube you can use, which is the SPS anticoagulant tube, which is that bottom right tube in the corner. For the most part, for blood cultures, you're going to see either the bottom left or the middle, depending on where you're working at. Site preparation with antiseptics. So the Clinical and Laboratory Standards Institute recommends chlorohexide gluconate for adults and infants over 2 months old. There's usually a packet that comes with the blood cultures, and it is usually pre-packaged, so everything's in there for you. Sometimes it's not, and people in the lab are actually creating our own packages. So we're putting in those blood culture bottles, we're putting in, the antiseptics and stuff like that as well. So depending on where you end up working, you may see them come in already, or you may be putting them together. So proper antiseptic preparation of the skin reduces the presence of normal skin flora, which means our skin has bacteria on it. That's just part of life. So we need to make sure that we clean it really well because we don't want those normal flora bacteria to get into the blood culture bottles, because that could then be a contaminant and could actually reduce what we are looking for. So it could actually give us a false positive in the lab when in reality, they don't have anything or something of that nature. So as mentioned before, we have different alcoholic preparations. So we can use iodine, providone iodine, or the chlorohexide gluconate. These are the preferred antiseptics for collection of blood cultures. We also will apply antiseptic to the top of the blood culture containers before adding patient blood, and that just also helps to reduce contamination because of normal flora. And a lot of times these tubes sometimes are sitting out, so there's things, floating around as well. So we just clean the top of them before we put in the patient sample. Timing, the number of organisms in the bloodstream is often highest just before a spike in the patient's temperature. By frequently recording the temperature, these spikes can often be predicted and collection scheduled accordingly. In other situations, collection may be timed at regular intervals, often hourly or just before an antibiotic administration. Multiple sites. So it is better if we can collect 2 pairs of samples from 2 different sites. So example would be one from the right arm, one from the left arm. That's just the best option that we have. Contamination of the sample by skin bacteria is a frequent complication of blood culture collection. However, distinguishing contaminants from true pathogens can actually be difficult because some of these contaminants can grow in indwelling devices, which can actually cause infection in the patient. So to help reduce these errors that are caused by contamination, a known skin contaminant must be cultured from at least 2 separate sites to be considered for a blood pathogen. Blood culture collection. So we're going to prepare the site. So after identifying the site, you're going to scrub it vigorously with the alcohol to clean about 1.5 to 2 inches beyond the extended puncture site. You're going to scrub vigorously with a 2% iodine or providone iodine swab stick, and then you are going to avoid touching the site once it has been cleaned. Just like a regular venipuncture, once it's been cleaned, we don't want to touch it again because it could become contaminated. And then you're going to prepare your collection equipment. And then you're going to collect your samples. So you're going to reapply that tourniquet and perform the venipuncture as normal. And then you're going to attend to the patient. After collection, you're going to remove the iodine from the patient's arm with alcohol. Iodine has like that orangey kind of color to it. So if you use an alcohol pad to clean it, it'll actually come off. You're going to check the puncture site to be sure bleeding has stopped, and then you're going to apply a bandage just like normal, like a normal venipuncture. So when you are collecting the sample, you're going to collect 2 samples like mentioned earlier. You're going to label one as anaerobic and one as aerobic, and then you're also going to indicate the site of the puncture, so right arm, left arm, something of that nature. There are different bottles, and the bottles will actually state if they're anaerobic or aerobic, so just make sure to keep that in mind when you are drawing those as well. And as mentioned, you're not going to touch that puncture site because we don't want it to be contaminated. As always, if you're drawing in the hospital, make sure you raise the bed rail if you lowered it. We don't want any patients falling out of their bed. And then at the very end, you're going to dispose of all of your contaminated materials in that biohazard container, just like normal. So depending on where you work, you may actually collect blood donor collection blood. So, excuse me, blood donation is a vital link in the healthcare system, and phlebotomists do play a role in this as they collect the donated blood. Blood banks collect and store that donated blood for use in emergent and scheduled transfusions for patients. There are guidelines for uniform collection procedures and safeguards that have been established by the American Association of Blood Banks, or the AABB, and the FDA. So potential donors must be screened to ensure that donation is not harmful to the donor or the recipient. Donors must be at least 17 years old, 16 in some states though. They must weigh a minimum of 110 pounds and not have donated blood in the past 8 weeks. The donor must provide his or her name, date of birth, address, and other identifying information in a written consent. The interview is done in private by a trained interviewer. Potential donors may be rejected for a variety of reasons, including if they've been exposed to HIV or hepatitis, if they're using current drug use, or cardiovascular conditions. The donor's weight, temperature, blood pressure, pulse, and hemoglobin level are determined generally on site to ensure that it is going to be safe for them to donate blood. And as mentioned, the screening will involve a registration, an interview, and medical history and a physical examination, which will look over all of those things we just listed. Blood collection procedures. So the blood is collected by a unit, so it's actually a bag, and that bag is a volume up to 400 to 500 milliliters. It is collected directly into that bag, which hangs below the collection site and is filled by gravity. The weight of the filled bag triggers a clamp that stops the collection, and we usually use a pretty large needle for this. It's usually a 16 to 18 gauge needle, which is used for the collection. So we are going to need to use a large vein as well for the collection of this. We usually will find that in the antecubital area. The site is cleaned just like normal with iodine or alcohol. After the puncture, the needle is secured to the arm with tape to prevent motion during the collection. And then the donor is actually instructed to pump his or her fist. That actually helps to increase the blood flow. You can also have sometimes an autologous donation. An autologous donation is blood that is donated by the patient to be used for them later. So if they know that they're having a surgery, they can actually donate their own blood and then request that to be used for them if they need it during surgery. Lots of times there's multiple units that might be needed during surgery, so patients may need to donate several times to make sure that they have enough blood stored up, basically, for us to use for them if it's needed. A patient can donate as often as every 72 hours, assuming that they're in good health. And we would also check the hemoglobin during the donation series to make sure that it does not fall below 11 grams per deciliter. Sometimes we also need to do therapeutic phlebotomy, and what this is basically the removal of blood from the patient, and it's usually for treatment or a certain disorder. So some people may have disorders like polycythemia, where they just create too much red blood cells, and they need to get rid of that, basically. So that is where we would come in and we would actually, take some blood off of them. In that case, there would be periodic removal of a unit of blood, and that may actually just be part of their treatment program. So they may not need medications, but they would come in to get their blood taken out. There are also things called cold agglutinins, and these are antibodies that are often formed in response to infection with Mycoplasma pneumoniae. And this is a cause of atypical pneumonia. So these antibodies are created by the immune system during the infection, and they can also react with red blood cells at temperatures below body temp. So once we draw the blood, it comes out of body temp, and now it can cause it, because it's getting colder, right, at room temp, it's causing them to stick together, which is called cold agglutinins. Agglutination is actually the process of sticking together. So because the agglutinins attach to the red blood cells at cold temperatures, the specimen must be kept warm until the serum is separated from the cells to avoid falsely lowering those agglutinin levels. A patient with cold agglutinins is sometimes asymptomatic because they wouldn't know it. Their body's always warm. But the presence of the antibodies can cause problems if the patient's body temperature falls. So to collect a cold agglutinin sample, lots of times you can have a pre-warmed tube that's been sitting in an incubator for 30 minutes. And then to keep that specimen warm, it can be wrapped in a heel warmer pack, or it can be placed in an incubator as well. And then we're going to want to deliver that sample as quickly as possible to the lab so it doesn't have that chance to get cooler. So there's also warm collection and storage that's also needed for two other types of samples. That's your cryofibrinogen, which is an abnormal type of fibrinogen, and cryoglobulin, which is an abnormal serum protein. Both will precipitate when it's cold and then will redissolve or go away when it's warmed up. So these samples should be collected and handled in the same manner as a cold agglutinin. Chilled samples, so there are some tests that actually need to be cold, and it requires the sample to be chilled or put on ice actually after it is drawn. So chilling is used to prevent chemical changes that could potentially alter the test results. So essentially what you're doing is you're putting it in ice and you're stopping it from converting or changing to what the body would normally do. The temperature for that should be around 1 to 5 degrees Celsius, and the sample should be transported to the lab for testing within 5 minutes of collection. So as mentioned, it should be usually put in ice or some places actually have ice like transfer containers that the tube would actually go into, and it's like a little frozen box. So just kind of, again, will depend on where you're working and what materials they have. So an example of this that would need to be chilled is a lactic acid. Those generally will need to be put into ice. Again, it's going to depend on where you're working and if it's actually needed, but that's usually one that we would need. There are light sensitive specimens as well. So exposure to light can break down or alter certain parts of the blood. Specimens to be tested for these tests must be protected from light after collection. And if you remember back from a previous lecture, we talked about bilirubin. That is kind of a big one that you'll see that actually does need to be prevented from seeing the light. And by doing that, you can do it by wrapping the tube in aluminum foil immediately after collection. There are also some tubes that you may see, depending on where you're working, where the tube itself is actually like a brown kind of color, and that is actually going to protect it from the light as well. And then you may sometimes find legal or forensic specimens. So the blood specimens may be collected for use as evidence in legal proceedings. And these can include alcohol and drug testing, DNA analysis, or paternity or parentage testing. The most important concept in handling these forensic specimens is called a chain of custody form. So this, you will have certain protocols when you are at your facility, so make sure you are following those to a T, because this is generally super important. It's going to go to legal, and we need to make sure that we do everything appropriately to make sure that the case goes on as it should. So the chain, part of the chain of custody, it is going to begin with patient identification and will continue through every step of the collection and testing process. The chain of custody documentation includes special containers, seals, and forms, as well as the date, time, and identification of the handler. So if you collect the sample on this, you are going to be the one signing off on it, and then you would sign off again once you hand it off to somebody else. That's kind of where the chain part comes in. So every step of the way, there is documentation for these samples. The purpose and procedure of the test must be explained to the patient. So again, we need to tell them why we're doing it. The patient must sign a consent form. They must have a picture identification. Again, this is going to depend on your policies, so make sure you know what those are. The specimen must be labeled appropriately, just like every other specimen, but sometimes in a chain of custody, they may have another sample ID or something of that nature that needs to be labeled as well. The specimen must be sealed in such a way that any tampering can be identified. So a lot of times, if it's like a urine or something like that, we'll actually put like a sticker over the lid onto the container, and that would just show, if that sample was open, because that sticker would be broken. So if it was open, that means that there was potential tampering, and then the results would be null and void. So the specimen must be placed in a locked container before transport, and that's, again, just another safety precaution to assure the samples are not being tampered with. And then the recipient must sign for delivery of the specimen as well, and that just, again, is part of the chain, shows that everything went as it should and has not been messed with. Legal alcohol collection. So important features to know when you are testing for alcohol is the site cannot be cleaned with alcohol, as this would, falsely elevate that result. So the tubes must be filled as full as the vacuum allows to minimize the escape of alcohol from the specimen into the space above. And then on the requisition form, the site needs to be cleansed with soap, water, or another non-alcoholic solution. So we just need to make sure that we document that to prove that we did not clean it with alcohol. There are also some other time-sensitive blood tests as well. So some analytes are just unstable or volatile, and because of this, the test must be performed rapidly after the sample is taken. So examples of this are your ACTH, your ammonia, your BNP or your brain natriuretic peptide, lactate, platelet aggregation, and prosthetic and phosphatase testing.